go.
At the Bondi Referral Hospital Sash, Alana is arriving with 7-month-old Callie.
We noticed that she had some little holes in the top of her mouth. There's a bit of blood around them. So I really have no clue what's going on or what she's done, but it looks like it might be something to worry about.
I'm gonna fix your mouth. Yeah, we'll make you all better.
Callie is definitely my little baby. She's spoiled beyond belief, so I want to make sure that there's nothing wrong with her.
So what's happening?
She likes to chew lots of things.
Yeah.
She's always chewing sticks and rocks and that. But I'm not sure if she's punctured something or got like a hole from chewing on something.
Sure. So I'm just going to have a look in her mouth and see if we can work out exactly what's causing this problem. Oh, doesn't look good. It's only when I open up her mouth that I notice that her canine teeth are sitting far back and they're actually digging their way up into her palate, and that's not normal at all. Those bottom canine teeth, they're actually not sitting where they should be, and what they're doing is they're burrowing up into her palate and they're making those little ulcers, and if we don't do anything about it, those canine teeth will just progressively burrow through her palate, and eventually, in the worst case scenario, they can almost make holes right up into her nasal cavity.
That's pretty bad.
Yeah, it's pretty serious if we get to that stage. The best thing we can do is try and treat her now so that it's not going to progress and end up with a serious surgical problem. If we don't treat it, it's going to cause her lifelong pain, discomfort, difficulty eating. It's something we really need to treat straight away.
It's okay. She's just a little baby, so I want to make sure we can do whatever we can to help her. Do the best.
Hi, this is Callie.
Hi, Callie.
And Alana.
Hello.
At Sash, 7-month-old Callie has a big problem inside her mouth.
Alana noticed that she had some little craters on her top palate.
Lisa is hoping specialist veterinary dentist Nadine Fiani can find a solution to help the staffy.
It seems like her lower canines are not occluding in the way that they should. They're just not lining up. But I'd love your opinion on what we can do.
Let's have a look inside. Let's open up that little mouth. Wow, you can see the dents right in the roof of her mouth. That certainly does not look right at all. Wow. So this is a pretty nasty problem. You're absolutely right, Lisa.
The first thing I could see was that her two lower canines, her big fang teeth, instead of sitting in this sort of angle, they're actually sitting a little too upright. They're standing up. And what that means is when Callie closes her mouth, those two fang teeth are now poking up into the roof of her mouth, and they're causing dents. They're causing indentations or trauma to the roof of her mouth.
Is there something we can do to help her?
She's very lucky. I think we can probably put on some doggy braces.
Doggy braces, sure. I did not think that they were going to say that she needed braces. I'd never ever heard of a dog with braces. So is it like human braces? Or?
They're a little bit similar to what people can have sometimes on their teeth. We're going to move her upper canines back, and once there's a bit more room, we'll try and shift the problematic lower canines out of the way so that she's not having that painful problem anymore. We're not trying to make her win a beauty contest, we just want her to be comfortable.
Yeah, I don't want her to be in pain, so...
Oh, that's good.
She's the most loved member of our family, so anything that she needs, I will do for her.
Callie will be a pioneer and one of the first dogs ever to have braces fitted at Sash.
Callie's provided us the perfect
Absolutely.
case for it, and the beauty of this procedure is that it's completely non-invasive.
As horrible as Callie's problem is, the exciting thing is we can put braces on her to fix this. Hey, you're going to get braces on very soon.
Stage 1 of Callie's orthodontic treatment will take place later this afternoon. For now, it's time for Alana to say her goodbyes.
We'll see you soon.
It's pretty amazing that we can do this for her. I'm sure some people are going to think I've lost my mind putting braces on my dog, and they might sort of think I'm just doing it so they look pretty, but we're going to do this so she isn't in any pain anymore.
There you go, Callie.
Today is a huge milestone for courageous Callie.
You're a good girl.
After weeks of intense treatment at Sash, the staffy pup is back for what's hopefully her final procedure.
We're going to be removing her orthodontic appliance today, and hopefully that'll be it. We'll be done. That's a good girl.
The first step is removing Callie's plate.
We're going to score the appliance itself, and then we're actually going to crack it off bit by bit. We do that very carefully because we don't want to hurt the teeth underneath it.
Today's the big day. Callie is having her plate removed. So excited to see how it turns out.
Oh, there we go. The whole lot just came off. Thank you. Fantastic. So I'll just get the last bits and pieces off. We are going to just make sure that everything's fitting together okay. There we go.
I'm always nervous at this part of the procedure because it's really the moment of truth to see if all the work that we've done has actually been successful. So fingers crossed our teeth fit together properly.
Oh, beautiful. So we can see immediately that now her lower canines are on the outside of her upper canines, which they weren't before. Previously, they were just sitting right in there, inside her palate, inside the roof of her mouth, and they were causing all manner of trauma. So that's no longer the case.
The braces, the plate, everything has done its work. Our lower canines are now in completely the right spot. They're not going to poke through the roof of her mouth, but most importantly, she'll be very, very comfortable.
Aren't you the prettiest girl now? You're so pretty. Lovely teeth that don't hurt.
Callie, you're going home, sweetheart. You're going home. Come on, somebody's waiting for you. I know.
Later that afternoon, Callie has slept off her sedation and is ready to be reunited with her devoted owner, Alana.
I can't wait for Alana to see Callie's new smile. They have been through weeks and weeks of procedures, and her devotion and dedication to her dog is quite remarkable. I just can't wait for her to see her little girl at the end of the day. She is going to be so excited. Go, 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 go.
Hello, Mama. Hello. Hello. Yes. Hello, princess. Hello.
Callie, come on, show Mum your teeth.
Show me. Oh, look how pretty they are. Oh, Baba.
Got a brand new smile.
Thank you so much.
My pleasure. It's really exciting to have been involved with Callie's treatment. She's now gone from a dog that had a painful mouth to one that's got a beautiful, normal functioning mouth, and she'll go on and lead a happy, healthy life.
Thank you.
Thank you.
Come on, Papa.
See you, Callie. Yeah, she thinks your teeth are beautiful.
Come on, let's go. It was definitely worth getting the puppy braces for Callie. We can be happy knowing that she's got a long, happy, healthy life ahead of her with plenty of love from all of us.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.